Hi, the next question I received is, can psychotherapy help anxiety? Hi, this is Jonathan Haverkamp again. Um, this is not medical or psychological advice. Um, Copyright Christian Jonathan Haverkamp. So let's look at the question. Can psychotherapy help anxiety? Well, yes, it can. I mean, that's at least for my everyday working practice, and it's also what a lot of research shows, that psychotherapy can help against anxiety. Now, one has to say there are different forms of anxiety. There's more physically experienced anxiety. You may have heart palpitations, difficulties breathing, sweating, all kinds of other things that can go on in your body. And then there's the more worry-centric, kind of the more thought-centered anxiety, which is essentially the anxious worrying. Now, very often, of course, they come together. It's one thing. It's anxiety from a felt in the body, as well as the worrying thoughts in the mind. Although one can have more and one or the other. So the more physically experienced anxiety, if you feel anxious, maybe you also have a tendency towards panic attacks, which you feel more in the body. This is something where, of course, psychotherapy can be helpful, but also supportive therapies along psychotherapy can be helpful as well. So, for example, mindfulness meditation, gentle forms of exercise, swimming, lots of other things as well. Yoga. Important is that it's good for you, and it doesn't increase the anxiety or cause any other issues. So the psychotherapy should be about at least two things. It should give you the tools to work with the anxiety without constantly having to push it away, which often makes it worse, and to, of course, in the long run, then to decrease it to kind of a normal, everyday level, but it should also help you to understand why you're anxious. So anxiety is often a powerful signal, and it can tell you, for example, that something in your life is not aligning. Like, for example, you may be in a job where you feel you have no choice but to be in that job, but you're unhappy with it. Well, often can increase anxiety, as can relationship issues and other things, where anxiety essentially screams out and says, okay, you need to look at this, you need to fix something here or change something. So very often it's about change. Anxiety wants us to change something. Now, of course, one can also have anxiety without any apparent reason in the present. There can also be reasons in the past. There can be traumatic experiences, or other reasons that explains why you feel maybe less secure in the world, or why you might be doing things in a certain way, which is not very helpful anymore. And this is where psychotherapy is supposed to not just give you answers, but help you to change that. So, yes, psychotherapy can help against anxiety. And it does, as we just said, it does by getting greater insight, but also by giving you tools that help against the anxiety. Now, one of the most powerful tools is on the communication side, where you communicate with yourself on the inside and with the world on the outside plays a large role. For example, if you have difficulties saying no in situations where something is not right for you, like, as going back to the job example, there could be many other things that, of course, can make over time it can make anxiety worse. So communicating what you need, what you value, what's important to you, your aspirations, all that is important when it comes to anxiety, to communicate it to the outside world. But that means also first you have to communicate with yourself as much that you actually know what these basic parameters are. And psychotherapy should be helpful with all that. It does that by also focusing on communication, your internal and your external communication, and looking at the communication patterns you're using, which can be done in a session and between you and the therapist. So there are many different schools of psychotherapy, more insight-oriented ones like the psychodynamic psychotherapy, more tools-based ones like CBT, more interpersonal focused ones, focusing on the interrelation and between you and the therapist, the interpersonal psychotherapy, IPT, and many others, Gestalt, and also systemic ones looking more at a broader system, like around you, like your family, like your work family, like friends, just your social environment, which of course also goes back to communication. So psychotherapy helps by focusing on communication and using lots of skills, lots of insight into working against anxiety and also anxiety attacks and panic attacks. So lots of symptoms and conditions that come with anxiety or based on anxiety. So I hope that was helpful. I'm looking forward to your next questions, and I hope you have a good time until then. Bye bye.